The Evoke is the latest release from InMode, a hands-free facelift. The technology works through radio frequency energy and constant monitoring of temperature, impedance, and tissue tightening 1,000 times a second. There's a face applicator and a neck applicator. The benefits of the Evoke are a safe and an effective hands-free jawline and facelift and neck lift. The Evoke works by carefully positioning the radio frequency thermal applicators along the pre-jowl of the jawline, descent tissue of the cheek, and unwanted excess tissue of the neck. The device then works by raising the temperature of the skin and the deep tissue and monitoring that temperature and other variables 1,000 times a second to ensure optimal safety and efficacy. The Evoke can shape your face, sculpt your face, improve lax jaw lines, and create a more oval or V shape to the face. There are two applicators. One is for the jawline and the face, and the other is for the submentum in the neck. The best candidates for the Evoke are those patients that are a little too young for a true facelift or a suture suspension lift, but they want something more than is currently available. They want something more than old Thermage or Ulthera or microneedling. They want a true lift and tightening effect of shaping and sculpting their face with no downtime. That is best suited for the Evoke. Age ranges for the Evoke really depends upon soft tissue laxity. Patients in their late 30s, early 40s with early jowling or loose neck skin can be a candidate, and even patients as old as in their 60s or early 70s with reasonably good skin tone could be a candidate for the Evoke hands-free facelift and remodeling device. When I'm talking to one of my patients about a facelift or a suture suspension facelift or even a fractional radio frequency resurfacing or Accutite face tape, there's always going to be some downtime. One of the many benefits, face in your neck, set the appropriate time for your soft tissue, and in 25, 30, 40 minutes you're done. You can go right back to work. Typically the protocol is one treatment a month for 3 months, and often we'll combine the Evoke with the Morpheus, a fractional radio frequency needle device that mini facelift, suture suspension, thread lift surgery, again, minimally invasive, and then other tightening tissue technologies like focused ultrasound called Ulthera, radio frequency devices like the Forma or the Exelis, or the fractionated technology like the Fraxel. But most of those devices are quite old, years old. They don't give the same tissue tightening, and they're also painful. The Evoke is painless, it works, you get a jawline, face, and neck lift, and there's no recovery. And one of the best features of the Evoke in this COVID-19 era, or any era where there's concerns about communicable disease in the fall and the winter influenza season, this is a no-touch technique. You're hooked up the machine, you set the appropriate parameters and time, and then the treatment starts. You can be reading your emails or a magazine or a book until you're done. There's no technician in that 1 foot zone, no treatment nurse or esthetician that needs to come in close to do any kind of intervention. A hands-free technology that works. But let's take a look at a treatment with the Evoke. In deciding where to get your anti-aging clinic in the country, I myself do a lot of facelifts. I developed the suture suspension thread lift. I helped develop and work with a company that released the Evoke. We know it well, we have the most experience, And we know who's the best candidate. And surprisingly, despite being one of the best, if not the best, hands-free facelift center in the country, we're affordable. We look forward to seeing you soon.